have the power to make a difference, yet some of us are not taking personal responsibility. That's right. COVID-19 cases and deaths are on the rise. We're running out of bed space at our hospitals, and still, some of us flout the prevention and control measures that have been implemented to keep us safe. We are all in this together. We all have a duty to play in keeping each other safe. Let's be our brother's keeper, as we are one Jamaica, one family.
The following is brought to you by the Office of the Prime Minister.
The best indicator of Jamaica's capacity in managing the health system would be the number of beds that we have. And we have to be very careful about how we as a country loosen our measures, because very rapidly this virus could spread and the number of beds that we have could easily be used up. That would throw us into a crisis. It was not so long ago, in February, that we approached that crisis level. We do not want to get there again.
The proceeding was brought to you by the Office of the Prime Minister.
Good day, I'm Stephen McHugh, and this is your JIS News for Monday, August 16, 2021. $4 million will be donated to upgrade the Gordontown Health Center over the next 4 years under the Ministry of Health and Wellness's Adopt a Clinic program. $1 million will be allocated annually to purchase clinical and office equipment and carry out minor infrastructure upgrades and maintenance of the facility. The commitment was made on Friday by the New Testament Temple Church of God and the Good Neighbors Community Outreach Agency of the United States in collaboration with the Global Jamaica Diaspora Council Northeast Division. Health Minister Dr. Christopher Tufton and other stakeholders welcomed the support.
The adoption process builds the community. They are grateful, as all the other communities are, for these adoptions, because the health center and primary health care is, in essence, your first port of call for healthy living, healthy lifestyle, prevention, and indeed more so even treatment in some instances.
It's the best clinic to adopt at this time, one that is in true need and one that will be eternally grateful.
The Adopt a Clinic program is a strategic initiative that seeks to proactively leverage the philanthropic support of the private sector and diaspora to play a critical role in improving Jamaica's primary healthcare system.
On behalf of the Board of Directors of Good Neighbors Community Outreach Agency, Bronx, New York, I'd like to thank you for developing this Adopt a Clinic program and streamlining it in such a way that we're able to make the decisions to adopt the Gordontown Clinic without hesitation.
The Type 3 facility provides curative maternal child health, mental health, sexually transmitted disease care, and dental health services to about 1,750 patients per month. Minister without portfolio in the Ministry of Economic Growth and Job Creation, Everald Warmington, has promised to make funds available to address the Summerfield to Frankfield Main Road in Clarendon. Mr. Warmington made the pledge recently as he toured roads in the northwestern part of the parish. He says the National Works Agency's Clarendon office has been asked to provide the ministry with an estimate of the cost to fix the roadway, which spans Summerfield into Trout Hall and Frankfield.
As soon as I get those estimates for that from Summerfield to Frankfield, I'll make sure that funds are made available immediately.
In the meantime, he says, tenders have been issued to improve roadways at Grantham, Effort Road, Victoria, and Coffee Piece, as well as the Southwood Bridge. Overlay works are also to begin shortly on the Andrew Hill Main Road.
The others, when we look at the Victoria Thompson Town Road, the Copperwood, we have the Trout Breakaway, Coffee Factory Breakaway, quite a few places here we need to look at. Grantham Breakaway, Sanguinity Cross Trains, Smithville, Cornell Breakaway, Leicester 9 turn, Leicesterfield and 9 turn. These are areas that badly need to be addressed and repaired, and I've asked the team to give me some estimate.
The Ministry of Transport is finalizing arrangements to begin a school train service in St. Catherine this September. Portfolio Minister Robert Montague hosted stakeholders aboard a Jamaica Railway Corporation JRC passenger train last Thursday for a final test run of the service. It included students and teachers from several St. Catherine schools, representatives of the Ministries of Education and Health, the St. Catherine Municipal Corporation, Jamaica Urban Transit Company, and the Jamaica Constabulary Force. The school train service will supplement the existing public passenger transport offerings. According to Minister Montague, with public passenger vehicles mandated to carry less than their licensed number of passengers in line with COVID safety protocols, it will be easier to move students using the rail service. It will initially operate one round trip per day from Spanish Town to Linstead and from Old Harbour to Spanish Town. The Jamaica Railway Corporation, JUTC, and the Education Ministry are partnering to deliver the service. Work will soon get underway for the build-out of GovNet, the broadband network for the public sector. It will provide a secure network to enable data sharing and online communication among government entities and support the provision of shared corporate services and key enterprise systems, including MyHR+. GovNet is being executed in phases, the first of which is being done under the Transformation Implementation Unit's Public Sector Transformation Program. This first phase is expected to cost $6.5 million and is to be completed in 2022. Project manager Luke Jackson says Phase 1 is aimed at building out the core of the network, which will see the first 50 ministries, departments, and agencies of government being connected across Kingston and St. Catherine. He says once they have built that core, the network will be expanded to connect the other parishes. The Transformation Implementation Unit is now in the process of evaluating bids to move to the next stage, which includes the approval process, signing of contracts, and procurement. And finally, an additional 207 Justices of the Peace, JPs, have been commissioned into service. During last Wednesday's virtual service, Justice Minister Delroy Chuck encouraged the new JPs to offer their service with honesty and dignity.
Stand up against anyone who would seek to use your service and to corrupt the process of governance or corrupt generally. And you, oftentimes, Justice of the Peace, you are the gateway to illegality and corruption. And I mean it. Because if you sign a form of someone you don't know and swear and affirm that that person is known to you when you meet the person for the first time, you are undermining the integrity of your office and impeaching your conscience. So it is much better for you to just say to the person, I don't know you. I can't swear that I know you.
The new cohort boosts the complement of JPs serving St. Catherine to just over 1,000. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.
As the call for vaccination against the novel coronavirus gets louder, there's also a counterculture that has also emerged. Get the facts about the AstraZeneca vaccine being administered on the island.
Vaccination is not new to Jamaica. The fears of vaccination, I believe, especially given the situation with this pandemic, are to a large degree unfounded because we have our own history to rely on. And indeed, with new births in the island, it is our public health requirement that they are vaccinated for various diseases. And that goes on almost on a daily basis. And we do go back to the clinics for vaccination for booster shots.
This is a disease that we have to take seriously. Many people, it is true, luckily, the majority of persons who get COVID may have some symptoms, some have no symptoms at all, especially if you're young. But if you are older, then as many as 1 out of 6 who gets COVID, who is over 70 years of age, is likely to die. And if you're over 80 years of age, then 1 out of 4 may die. So our best hope to control this epidemic is the vaccine. Now, I have the privilege of being on the World Health Organization working group that is reviewing all the vaccines that have been prepared to protect people against COVID. We've looked at this vaccine, the AstraZeneca vaccine. The World Health Organization has approved it as highly effective and safe.
If I take the vaccine, then I personally am safe from the disease. But if I'm the only one that takes the vaccine, it doesn't really do any public good because the disease, the virus is still around and still infecting. And indeed, though I am vaccinated and I may not get ill, I could still carry the virus. This is the beginning of the end. It is not the end. We are right there now, where if we behave responsibly, personally responsible, and as a community responsible, then we can bring the end of this pandemic earlier. A few things that we have to understand. One, it is the scarcity of the supply. Once you introduce pricing as a means of rationing how the vaccine is distributed, then what it means is that people who can afford the price will get it, and those who can't won't. And that is not good for social stability. The second issue is to ensure proper regulation, right? We need to be able, with certainty, that the persons, that we have captured the information of the persons who got the vaccine, and be able at very short notice with, if they know if anything went wrong, especially in terms of the batches and how they are distributed. So tracking is important.
We're asking that the country, all of our people, support us. When it's time to be vaccinated, let's do it in the orderly manner that we can. Let's make ourselves, our entire country proud of just us accepting the vaccine and doing it the way we know we should. And remember, we're trying our very best to ensure that no one is left behind.
It's absolutely critical that we receive the vaccines. You will see hospitalizations and indeed deaths likely come down. And so there is a lot of value to be gained by getting as many vulnerables on board as possible. So tell your mothers, tell your aunts, listen out for yourselves if you're over 60, and take the vax, because the vax is what will help you to guard against the COVID virus, and indeed help your relatives, your friends, those who you come in contact with, for the same benefit.
While your health is your responsibility, the state has a duty to keep us all safe. This is being done through the COVID-19 containment measures. Breaches of these rules will be met with serious penalties. Get the details next.
These penalties do not replace the sanctions for offenses that are already in the Principal Disaster Risk Management Act. Anyone who commits an offense, who is brought to the court, convicted before a resident magistrate, parish court, is still liable to the maximum fine of $1 million or to imprisonment not exceeding 1 year.
The Disaster Risk Management Amendment Act 2021 was passed in both houses of Parliament to strengthen the enforcement of COVID-19 protocols. The bill specifies 10 levels or tiers of fixed penalties, which range from $3,000 for first-level offences to $500,000 for offences at the 10th level. There are 40 offences specified that attract these fixed penalties. Among the penalties are a $5,000 fine for not wearing a mask in a public place, refusing to comply with social distance rules, and breaching the rule governing public transportation. A $10,000 fine is to be paid by those who do not comply with the curfew order or who fail to stay at home when experiencing flu-like symptoms. Gathering in groups of more than 10, operating a gym outside of specified hours, or hosting small outdoor events are breaches that each attract a fine of $20,000. Jamaicans who fail to quarantine upon returning home from overseas will be charged $25,000, while tourists who refuse to stay inside the resilient corridor will face a $30,000 fine. Companies that do not comply with specified workplace requirements will be fined $50,000. A $50,000 fine will be meted out to persons who break quarantine after testing positive for COVID-19, and a $100,000 fine for those who conduct funerals, worship service, burials, or weddings in contravention of the Act. Bars operating outside of the times specified or operating without the necessary licenses will also be fined $100,000. Persons who operate a beach, zoo, or park outside of specified times will face a $250,000 fine. And hotels or resorts that fail to operate within the COVID-19 protocols will be fined $500,000. This fine also applies to operating a hotel or resort not licensed under the Tourist Board Act or certified by TPDCO. Nightclubs, amusement parks, or water attractions operating when ordered closed, and business process outsourcing companies which breach the protocols.
The notice also offers a chance of paying a fixed penalty for the offense within a specified period of time, failing which the notice becomes a summons to the court, a summons to appear in court to answer the charges.
Tropical storm Hugo has been upgraded to a hurricane and is expected to impact Jamaica. A hurricane warning is now in effect.
Wait! Did you know there are a few steps that have to be taken before a hurricane advisory is issued? Once a tropical cyclone has formed in the Atlantic or the Caribbean, the Met Service monitors it and puts plans in place in the likelihood that the system will affect Jamaica.
Hugo, we required additional staffing, especially for this.
These include increasing the number of technical staff working at the National Meteorological Center and the number of upper air observations daily, and ensuring that the weather and technical equipment in the office are fully functional. They are in constant dialogue with the National Hurricane Center in the United States, which provides regular updates on the system. Once the Met Service does an assessment and determines that the system is a threat to Jamaica, the following will unfold.
Yes, Prime Minister Holness. Yes, Evan Thompson here from the Met Service. I'm really just calling to update you on the situation with Hurricane Hugo. It continues to move closer to the island, and so we believe that it will be necessary for us to move to that hurricane warning. So we're just making sure that we have your approval.
Then?
Hello, yes, hurricane specialist, please. Hi, how are you doing? Evan here again from Jamaica. Right, I've just spoken with the Prime Minister. He's in agreement that we go to the hurricane warning by 5 o'clock this evening. That's correct.
The National Hurricane Center publicizes this information internationally, and the Met Service prepares and sends bulletins to the local media. And that is how we get here.
A hurricane warning is now in effect for the island.
And as the country prepares for the weather system, the Met Service continues to play a critical role in the country's disaster readiness, providing information to the Office of Disaster Preparedness and Emergency Management and the local government ministry. These entities use this information to determine which areas on the island should be evacuated and where shelters should be opened. That's not all. The Met Service also works closely with the Coast Guard to evacuate fishermen at sea, on the Keys and Banks before the storm hits. That is how the Met Service keeps Jamaicans in the know so that they can better prepare for any severe weather system.
On August 20, 2007, Hurricane Dean made landfall on the southern end of the island, resulting in 3 deaths and $310 million worth of damage. It is important that we prepare ourselves for the hurricane season, and that preparation is even more pertinent during the pandemic. Find out more next.
I am here to highlight some of the COVID-19 protocols for the hurricane season. If we should have an adverse weather event, recognize that any one of those consequences of adverse weather events could be the trigger for that third wave. What we need to do for hurricane season, it's not novel. It's not novel. Bring it back to the fore and just remember that preparation is what we need to do, and more importantly, so just remind ourselves of what we need to do. And now focus on what we need to take into consideration for COVID-19. The fundamental concepts remain unchanged. Spacing, physical distancing, mask etiquette, and sanitization. It goes hand in hand in everything. We must incorporate the learned best practices that we would have had from last year. We went into a season last year with an ongoing pandemic. We would have done some things. We would have learned some things. Don't forget what you have learned. You best know how to respond in your own personal space. Personal responsibility, personal preparedness. We cannot go into a third wave. Because we need to respond, sometimes the fear and the anxiety can in fact cause us to do things and forget what those protocols are. I'm asking you and I'm charging you to remember what they are at all times. Exercise them every day so it becomes routine and normal. When you're nervous, sometimes what you fall back on is what you practice every day. So practice the COVID-19 protocols every day. If we need to respond, it will be well ironed out by the time it comes around.
Do you own land and need a title? Well, the National Land Agency NLA can help. Through the systematic land registration process, the NLA will assist residents to get titles in declared project areas across Jamaica. Systematic land registration is the methodical and orderly registration of parcels of land in a designated area known as systematic adjudication area. For further information on the systematic land registration process, including declared systematic adjudication areas, who can apply and the benefits, visit the National Land Agency's website at www.nla.gov.jm or email asknla@nla.gov.jm. The National Land Agency, one agency, one goal.
Up to August 3, 691,267 trees have been planted under the National Tree Planting Initiative, and with it, 4,490 tons of carbon removed from the atmosphere. Be inspired to take part in this program that is helping to make Jamaica the place of choice to live, work, raise families, and do business.
Do what you can, where you can, to restore our ecosystems and preserve our environment. We owe it to ourselves as Jamaicans and to ourselves as global citizens.
The National Road Operating and Constructing Company, NROC, has responded to that call, planting trees across Jamaica. And just recently, those activities took NROC to Hope Village in Manchester. NROC's 30,000 Trees in 4 Years initiative began in January 2021. Since then, the program has been gaining support from communities in which NROC operates. As the government entity responsible for the establishment, development, financing, operation and maintenance of tolled highways, NROC has bases across the island. That includes Highway 2000, where extension work is currently being done on the east-west leg between Maypen in Clarendon and Williamsfield in Manchester.
When you do a highway, you remove fruit trees from farms, and between Milk River and Williamsfield, we would have gone through a number of farms, remove cash crops and some fruit trees. So we thought that it would be good to give back to the farmers fruit trees to replace what we take out. And where we have open plots like this one, we would now put a program in place to do a blitz, as we call it, to plant trees.
The latest location chosen is the Hope Village community, which is adjacent to the Melrose Bypass Road. Home to an inactive fruit orchard, Hope Village was the ideal partner for the tree planting exercise. 400 assorted fruit trees, including ackee, apple, June plum, sweet tamarind and guava, were used to replenish the orchard.
As an association, we are extremely grateful because we believe not only music is a staff of life, but food also is a staff of life. And we are so very happy that they were able to partner with us and to take this fruit trees planting a step further than the few we had.
So it's a partnership and we're doing very well in terms of a community space, and the highway will impact this community very closely because it's close by.
Members of the Highway 2000 family also chipped in, including Stanley Consultants Limited, China Harbour Engineering Company, and Jamaica Infrastructure Operators.
So the Prime Minister, as you recall, had given us a charge to plant 3 million trees over the next 3 years. And so this is our part. Today, the people that have come with us, the team today, will plant about 6 trees per person. So we're well on the way.
The Rotaract Club of the University of the West Indies Mona campus also joined in on the tree planting exercise. This is their second such involvement, and by all indications, the partnership will continue.
Environmental awareness, environmental advocacy is one of the major areas of focus for Rotary International. For us, participating in an event like this is just natural.
Environmental stewardship is one of the big things internally for us, where we seek to maintain environmental balance. So, as we try to incorporate a new environmental standard into our overall standards, we're ISO 9001 company, and we're going to incorporate this year ISO 14001, which looks at environmental management. So that is part of it. This is part of that exercise to support how NROC operates as stewards of the environment.
We remain resilient in our fight against known and unknown threats to our country. We are never daunted.
We are committed to continuously deliver effective and efficient service when we save lives and protect property.
And we continue to reassure with courtesy, integrity, and respect for the rights of all.
We are building
forward
together.
That's all the time we have here on this station. Keep the lines of communication open. Email us, Jamaica Magazine@gis.gov.jm. Join us on all the major social media platforms. Visit our website and subscribe to our YouTube channel. Catch up with us while on the go by downloading our mobile app. We are here for you. On behalf of the entire team here at the GIS, I'm Adrian Atkinson. Do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.